You know that feeling? That mysterious ache in your tooth that just won't quit? So you go to the dentist, and suddenly it feels like you're in the middle of a detective show. Well, today we're going to pull back the curtain and show you exactly how your dentist plays detective to solve the case of your aching tooth. Right? You're sitting in the chair, and they start this whole series of strange seeming tests. But what are they actually doing? I promise you, it's not random. Every single tap, every little probe is a calculated step in an investigation to unmask the real culprit behind your pain. And here it is, the golden rule of dental detective work. Basically, the whole point of all that testing is to get your tooth to fess up. If the dentist can recreate the exact pain you've been feeling, but in a controlled way, boom, they've found the problem tooth. It's the first big break in the case. So, where does this whole investigation kick off? Well, not deep inside the tooth. Not yet. First, they have to check the tooth's foundation, the stuff that holds it in place. They need to figure out if the problem is coming from the nerve or from the support system around it. Okay, this is where that familiar tapping comes into play. It's called a percussion test, and it's checking for inflammation in what you can think of as the tooth's personal little shock absorber. If that cushion is sore, the tooth will be tender when tapped. Then there's the palpation test. That's when they press on your gum. They're checking to see if the inflammation has broken out of that little cushion and is spreading into the area around the tooth. Two super simple tests, but they give two really important first clues. All right, so the foundation looks okay. Now the detective work has to go deeper. The focus shifts to the living tissue inside the tooth, the pulp where the nerve lives. And the big question here is, how's that nerve doing? Is it healthy? Is it even alive in there? The next tool they pull out is temperature. These are called thermal tests. Think about it like this. Your dentist is using hot and cold to ask your nerve a direct question. A healthy nerve will basically say, "Whoa, that's cold." And then the feeling just fades away, almost instantly. If the pain sticks around, or if it's crazy intense, or if you feel nothing at all, well, those are all major clues that something's not right. So how do they actually do it? Well, for the cold tests, it might just be a little ice stick, or sometimes they use the super cold spray called endo ice. For the hot tests, they might use a tiny heated piece of a rubbery dental material, or even just a very targeted squirt of warm water. It all does the same thing. It just gets your nerve to react to a change in temperature. And this is the moment in the chair that can feel a little unnerving. The dentist puts that cold thing on your tooth, looks at you, and you feel absolutely nothing. Your mind immediately jumps to the worst, right? Does that mean the tooth is dead? Well, hold on, not necessarily. A lack of response could mean the pulp is necrotic, sure, but it could also mean a whole bunch of other things. Maybe you bumped the tooth recently. Maybe the nerve canal has just shrunk over time. Maybe you took a painkiller before your appointment. It could even mean only part of the pulp is in trouble. So a non-response is just another clue. It is definitely not the final verdict. So if the temperature tests are being a little mysterious, what's the next tool in the detective's kit? Well, they can use another method to talk to that nerve, a tiny, gentle electrical current. This is called the electrical pulp test, or EPT. And I know, it sounds a lot more intense than it is. It's really simple. They dry your teeth, put a little dab of what feels like toothpaste on the tip of the tester, and you just hold the other end. The dentist touches the tip to your tooth, and your only job is to let go the very second you feel a little buzz or a tingle. And what is the dentist looking for? They're watching a number go up on the machine's display. The moment you feel that tingle and let go, the number freezes. And there's really a magic number they're keeping an eye out for, the number 80. The result is pretty black and white. If you feel a tingle anywhere on that scale from 1 up to 79, it tells the dentist the nerve is vital. It's alive and kicking. But if the machine climbs all the way up to its maximum, 80, and you haven't felt a single thing, that's a very strong suggestion that the pulp is, in fact, necrotic. But, and this is a huge but, the EPT is not foolproof, not by a long shot. This test is actually famous for giving false positives, saying a nerve is alive when it isn't, and false negatives, saying it's dead when it's still alive. So it's a valuable clue for sure, but it's one the dentist has to treat with a little bit of healthy skepticism. And that brings us to the final act of this whole investigation. See, no single test gets to be the hero and solve the mystery. The dentist has to be a master detective, taking every single piece of evidence they've collected and putting it all together to finally see the whole picture.
Honestly, if you take one thing away from this, let it be this. One test is never enough. A single clue, whether it's a response to tapping or a lingering pain from cold or a high number on the EPT, that doesn't solve the case. Each one is just a piece of the puzzle. The true diagnosis only comes when you put all of the pieces together.
So that final report gets built by combining your story, what you feel and when you feel it, with all that physical evidence. The tapping test checks the tooth's cushion, the pressure test checks the gums, the temperature tests ask the nerve how it's feeling, and the electrical test gives one more clue about whether it's alive. Together, and only together, do they tell the full story. So the next time you find yourself in the dentist chair with some mystery toothache, you'll know exactly what's going on. It's not just random poking and prodding. It's a full-blown detective story unfolding right there, with your dentist as the lead investigator, piecing it all together. The only question left is, what clues are your teeth about to reveal?